I knew I was different from the time I was at least probably 10 years old.
I was about 19 years old when I finally decided to be who I am.
Well, when I tell you I'm a lesbian, it just means that's a fact. That's who I am.
Who I love and what I believe is no one's business, is it? Except when it comes to my medical care. Then there's things that people need to know.
At Ultimate, providing quality care without exception is who we are, right? Yet sometimes when dealing with patients whose appearance or sexual orientation is unlike our own, stereotypical views can affect our attitude toward them, and consequently the quality of care they receive.
Well, obviously I want to be a patient who is respectful.
It's tough enough having HIV. Being blamed for it because of who I am makes it even harder.
I want a provider to treat me and my partner like they would anybody else.
I really want to be a good patient. All I want from you is to be a good provider.
LGBT, what does it mean? It stands for
L, lesbian, women whose primary attraction is to other women.
G, gay, men whose primary attraction is to other men.
B, bisexual, individuals who are attracted to both men and women.
T, transgender, refers to individuals who do not identify with the sex that were assigned at birth.
And there are many other terms, such as intersex, queer, questioning. But this program isn't about terms, it's about people. Patients whose medical needs are our primary concern and mission to treat. It's been created to help you better understand the LGBT members within our medical community so we can become a more culturally sensitive organization and better care for the needs of all our patients. Still, many of us come with our own biases and prejudices. These may be part of our cultural, religious, or societal beliefs, or perhaps they just arise out of fear or misunderstanding. Our goal is to help you put aside assumptions, starting with whether or not we can choose our sexual orientation.
Okay, so sexual orientation happens on a lot of different planes, right? So like sexually, emotionally, psychologically, spiritually, to me, that's who you're drawn to and attracted to.
Gender identity is what the person expresses to be, whether it's male, female, or neither.
If we have negative attitudes towards any patient because of how they appear or how they behave, and whether we think that's normal or abnormal, right or wrong, those attitudes can come through to the patient whether we intend it or not. Generational and cultural biases have resulted in a medical community at large whose historical standards of care for LGBT patients have left many disillusioned, distrustful, and without adequate care.
It's been hard.
I've changed therapists a few different times because they didn't even know how to address me.
I had a doctor that I thought was pretty cool with me and stuff, and when I started talking to her about possibly wanting children, wanting a baby, it was like she went, whoom. It was like, wow, like all of a sudden a different person. And that was awful because she was my regular doctor, and to see her switch up like that, it kind of makes you feel like an alien.
It's just really difficult to find a person who you feel might give you better service that you feel more comfortable with.
It is an unfortunate fact that many people, both inside and outside the medical community, express homophobia, which is defined as an irrational fear of people who are gay or lesbian, resulting in hostile behavior, discrimination, and even violence in extreme cases. Similarly, transphobia negatively affects people's attitudes and actions toward people who are transgender, often expressed as discrimination, harassment, and violence. Both homophobia and transphobia are usually the result of heterosexism, the false belief that male-female sexuality is the only natural model of sexual behavior. Homophobia, transphobia, and heterosexism are experienced on both the individual and societal levels. Ask yourself, where do you land on this scale? Are you affirming, or do you belong closer to the phobic side? The unique issues faced by the LGBT community often begin in teen years and even in early childhood, making the necessity of understanding the needs of this community even more urgent. For example, it is a fact that many members of the LGBT community are at a statistically higher risk for not just sexually transmitted diseases, but also sexual violence and hate crimes.
In junior high, you're alone. The name calling, the bullying, the teen suicide.
I have been assaulted. I have been physically abused. I have been verbally abused. I mean, it happens constantly.
Many members of the LGBT community struggle with depression, anxiety, and even post-traumatic stress disorder as a result of overt and covert violence committed against them, or just plain old bigotry and homophobia they have to put up with on a day-to-day basis. If we display even subtle disapproval, whether intentional or not, we only add to what might already be serious medical issues and keep these patients from returning to their medical visits.
There are a lot of assumptions which are made by medical providers or other ancillary staff that can really push you back and not make you want to return.
What I want from a provider is to treat my partner and I as a family with respect and humanity.
Please be more friendly, more supportive, because a lot of people don't have support.
As medical professionals, we are committed to helping patients with all their concerns, medical, emotional, psychological, and even social. We live up to that commitment by focusing on health and wellness. At Altamed, we take pride in serving the community at large. Having a better understanding of our LGBT patients will help you more effectively deal with their individual needs.
If you don't know what pronouns to use, ask an individual.
I'm not ashamed of who I am, so when I tell you that I'm gay, it's okay to use that word.
Yes, it's okay to ask. Go ahead and ask me.
Just ask.